Radical cystectomy, ilial loop, conduit urinary diversion. This video gives you as much information as possible about what to expect after having surgery. What is a radical cystectomy? This is the surgical removal of the bladder. In men, the prostate gland is also removed. In women, the uterus is also removed. Normal urinary tract. The urinary tract is made up of 2 kidneys, 2 ureters, a bladder, and a urethra. The kidneys are towards your back at waist level. The kidneys filter blood and make urine. Each kidney has a ureter or tube that carries urine to the bladder. The bladder stores urine, then it is passed from your body through the urethra. What is an ileal conduit? Using part of your bowel as a conduit, the ureters, the 2 tubes that carry urine from the kidneys, are attached so that they empty through this loop. The other end is brought through the abdominal wall and a stoma is created. You will need to wear a bag over your stoma to collect urine at all times. What is a stoma? The stoma is the end part of the conduit that has been brought to the outside of the abdomen. There is no feeling in the stoma. The stoma will shrink during the first 2 months. The stitches around it will fall out by themselves over time. It is important to keep the surrounding tissue healthy around the stoma. Getting ready for surgery. Your preoperative exam will consist of a physical exam, lab tests, both blood and urine tests, a chest x-ray, and EKG. There may be additional tests per the surgeon's discretion, such as a venous duplex ultrasound. The purpose of this ultrasound is to look for any blood clots in the legs before surgery. You should get yourself as healthy as possible before surgery. Maintain your exercise plan. If you don't normally exercise, it is a good time to start walking. Eat a healthy diet that is full of protein to help with wound health post-operatively. You will also have teaching done with the urology nurses to help you get ready and provide any instructions that you need prior to your upcoming surgery. 1 week before surgery, you will need to stop taking over-the-counter pain relievers such as aspirin, ibuprofen, Advil, Illeal, naproxen, or prescription nonsteroidal anti-inflammatories. Tylenol is acceptable to take as needed for pain. Also stop taking any non-prescription vitamins and herbal supplements. These may thin your blood and put you at high risk for bleeding during surgery. We will work with you and your provider about specific instructions for stopping other blood-thinning medications that have been prescribed by your provider, such as warfarin, Plavix, Eliquis, or Xarelto. The day before surgery. During your preoperative teach, you will be instructed how to prepare your bowels for surgery. The goal is to get the bowel cleaned as much as possible when we create your new bladder. Before going to bed the night before surgery, shower with HIPAA-cleansed soap. Do not wash your face or genital area with this. Take another shower using the HIPAA-cleansed soap before leaving for the hospital in the morning. Do not apply any products to the body, such as lotions or deodorants. The day of surgery. The day of surgery, you will check into first day surgery in the hospital. First day surgery is located up the D elevator on the 3rd floor. Turn left off the elevator to first day surgery. Pack loose, comfortable clothes. You should bring your current medication list with you. You should also bring any inhalers, CPAP or BiPAP machine if you use one, or glucometer if you have those. Leave any valuables at home. After surgery, you will be assigned a hospital room. You should leave your belongings in the car until you reach your hospital room. Your hospital stay. This is a major abdominal surgery, so you should expect to stay in the hospital for 7 to 10 days. The day after your surgery, you are expected to get out of bed and walk. Moving and walking are the best way to speed your recovery. This helps to prevent pneumonia, blood clots, and gets your bowels moving after surgery. Use your pain medication to keep your pain at a mild level so that you are able to get up and move around. Incision, drains, and tubes. There is an incision along your abdomen. Your incision is held together with small staples. They allow the skin to heal with the least amount of scarring. There may be drainage from the incision. The incision will be cleaned and the dressing changed every day. Your staples will be removed at your first postoperative clinic visit. A stoma tube goes through your stoma and into your conduit. It helps drain urine from the conduit into your urostomy pouch and hold the stoma open. If it falls out, this is okay. There are 2 small tubes called stents that go into your conduit through the stoma and up the ureters into your kidneys. Stents drain the urine from the conduit while the conduit is healing. You will go home with the stents in place. Call the clinic if these fall out. They are taken out at your first follow-up visit. JP drain. JP drain is a soft rubber drain that is near your incision and comes out through the skin. It drains fluids from around your conduit. This helps prevent infection and speeds healing. A Foley catheter is a tube in your urethra to drain excess fluid from where your bladder was located. A nasogastric tube, or NG tube, goes through your nose and into your stomach. It drains your stomach. This is to help your bowel rest as it heals. This is placed while you are in surgery and stays in 3 to 5 days. It will be removed once you begin to pass gas. Home care. Wash your incision gently with soap and water once a day and pat dry. You may gently wipe off mucus buildup with plain warm water once a day if needed. Be very careful around sutures. The stoma may bleed when cleaned. This is normal. The bleeding should be small and it will stop on its own. Once healed, stomas may be uncovered during a shower, but should never be scrubbed and only patted gently with a soft towel. Your stoma tube and stents should be handled carefully when changing the urostomy bag. If the stents fall out, please call the clinic. If the stoma tube falls out, this is okay. The urostomy bag prevents urine from touching the skin or leaking out. You will be taught how to care for and change your ostomy bag. Your ostomy bag will need to be changed every 3 to 4 days or more often if needed. Changing your urostomy appliance. Change your appliance every 3 to 4 days and more often if needed. The steps are as follows. First, prepare the wafer barrier. Second, place towel or pad under the urostomy pouch and begin to remove the old barrier and pouch with an adhesive remover. Clean skin around the stoma with lukewarm tap water and dry. Then apply skin protectant on the skin around the stoma. Allow it to dry. If irritated, apply stoma adhesive powder on the irritated skin and dust off the excess. Apply a molded wafer barrier around the stoma. Gently rub wafer barrier area around the stoma. Remove the backing from the adhesive and smooth onto skin. Apply urostomy pouch to accordion ring or barrier. Ensure that pouch is closed. Empty the pouch when it is about 1/3 full. Drainage urostomy supplies. Most of the time, supplies are covered by your insurance. If you have Medicare, they will pay 80% of the cost. If you have a supplemental, it will often cover the other 20%. Many private insurance plans, or HMOs, will pay the full cost as long as they are prescribed and renewed every 90 days to have supply costs covered. After 6 months, you may call your primary doctor for a refill. We will provide a small amount of supplies when you are discharged. Most patients are set up for home health care when leaving the hospital. The social work team helps to set this up for you based on your insurance coverage. Once you are discharged from home health care, call us at 608-263-4757 and leave a message for the urostomy nurse with the name of your preferred provider. We will fax a prescription to them. Your provider may set up a regular schedule to deliver your supplies. Others want you to call when you need more. They will need a copy of your prescription. Discharge supplies continued. If you do not have Medicare, you will be discharged with enough supplies until your first clinic visit. At that time, you will receive a prescription for more supplies. Do not order too many supplies at one time before your first clinic visit. This is because most stomas shrink, and you will likely need a new prescription with your new wafer barrier at that clinic visit. Diet after surgery. Follow a soft general diet until your follow-up visit. Some foods may change the odor of your urine. Examples include eggs, fish, asparagus, spicy foods, and vitamins. You will find different foods that may change the odor as well. Drink at least 8 to 12 8-ounce glasses of liquid every day. It is very important to stay hydrated. Activity after surgery. Return to your normal routine as you are able. Walk around the house daily to decrease the chance of pneumonia or blood clots after surgery. Nothing more strenuous than walking until your doctor says that it is okay. Do not lift more than 10 pounds for 6 weeks after surgery. You may shower when all tube drains are removed. Do not soak in a bath, hot tub, or swim until your incision is healed. Check with your doctor. You will need to seal the stoma with a dressing and special tape or special cap. Do not drive for 4 weeks or while taking narcotic pain pills. No contact sports such as football, basketball, or racquetball until okayed by your doctor. Always empty your pouch before any activity in which trauma to the pouch area could occur. You may resume sexual activity when you are ready. Some people worry about being accepted by their partner. Talk about your feelings. Your loved one may be afraid of physically hurting you. You need to let them know that having sex will not harm the stoma. After 2 months, most people can return to the things that they enjoyed before surgery. Travel. Travel as much as you like. Always bring all of your supplies with you. Troubleshooting problems. Leaking. Make sure the area around the stoma is dry before you place the new pouch on. Empty your pouch when it is 1/3 full. When applying the wafer barrier, be sure you are putting pressure down around the stoma on the form-fitting portion. Remain lying down immediately after applying a new pouch for 30 minutes. Dark urine. Add more non-caffeinated fluids to your diet. Mucus in the urine. This is normal since your conduit is made out of bowel. Increase non-caffeinated beverages. Gently remove mucus from the stoma when changing your pouch. Bloody urine. Flecks of blood in the urine or on the stoma are normal. If your urine is pink or red, you may have an infection. Call the urology clinic. MedAlert identification. It is recommended that you carry a medical identification with you at all times. You should wear a medical alert bracelet or necklace with the following information engraved: Illeal Conduit Urinary Diversion. You can obtain the forms for a MedAlert ID from a pharmacy, or you can find them on the web at www.medalert.org or phone 888-633-4298. When to call the doctor. No urine output. Your urine is thick, cloudy, or foul smelling. If you have bloody urine, chills, a temperature that is higher than 100.4 for 2 readings that have been taken 4 hours apart, nausea and vomiting, abdominal or flank pain, pain you cannot control with your pain pills. Call the urology clinic at 608-263-4757.